Welcome to the deep dive. Today we're taking a closer look at something that's often hidden but actually pretty common in our dogs and cats.
Yeah, tooth root abscesses.
Exactly.
It's one of those things that can cause a lot of chronic pain, but,
Mhm.
pets are just so good at hiding it sometimes.
They really are, aren't they? And, well, that's why we've gathered a bunch of material veterinary guides, excerpts, that kind of thing, to really unpack it for you.
Mm-hmm.
Think of it as like a shortcut. We're pulling out the key bits, the insights, so you can get up to speed quickly on what it is, why it happens, and, what you can actually do about it.
Yeah, our aim is really to distill what's crucial from these sources about this condition, this painful condition, and how best to think about it.
Absolutely. So let's dive in. First things first, the basics. What exactly is a tooth root abscess in a pet?
Okay, so at its simplest, it's a pocket of pus. More technically, the sources call it an accumulation of inflammatory cells. That's the pus right at the very tip, the apex, of a tooth's root. And this happens when the tooth is, well, non-vital. That means the nerve and the blood supply inside, they're dead. It's often called a periapical abscess.
Non-vital. So the tooth itself is essentially dead inside.
Exactly. And the source material points out these abscesses can be acute, like sudden and really painful, or they can be chronic,
Right.
which might seem less painful on the surface, but there's still this ongoing infection underneath. They even have a term for a chronic one that suddenly flares up, a phoenix abscess.
A phoenix abscess. Kind of a cool name for something rising up like that. And once this abscess forms at the root tip, it doesn't just stay there, does it? The sources talk about how it spreads.
No, that's right. It tends to follow the path of least resistance,
Yep.
from that root apex. So it can spread into the surrounding bone, which
Ooh.
can potentially cause something called osteomyelitis, that's bone infection. And if it breaks through the outer layer of bone, then you get this diffuse inflammation in the soft tissues. You can call that cellulitis.
And that's often when people might start noticing something's wrong, isn't it? Because that cellulitis can cause, like, visible swelling.
Precisely. You might see a lump or swelling on the face. And sometimes the pressure builds up so much, the infection actually finds a way to drain out, like through the skin.
Wow.
Yeah, it creates what's called a draining tract or a cutaneous sinus. You might see some pus or maybe bloody discharge oozing from it.
So it could just look like a weird sore on their face or maybe a lump that keeps coming back.
Exactly that. Particularly on the face, below the eye is very, very classic for abscesses on those upper jaw teeth.
Okay.
And while it's less common than that local spread, the sources do mention the potential for bacteria from the abscess to get into the bloodstream and maybe spread to other organs. But thankfully, that's not the typical scenario.
Right. Okay, so it starts small but can definitely have wider effects. The material also mentions periodontal disease. Does that play into how these start?
It can, yeah. I mean, fractured teeth are probably the most common trigger.
Yeah.
But severe periodontal disease,
Yeah.
where there's infection and bone loss around the tooth. Sometimes that can progress so deep it actually reaches the root apex.
Ah, okay.
And when that happens, you get what they call a perioendolesion. It affects both the tissues around the tooth and the inside of the tooth.
Interesting. Different routes to the same problem. Can, like, any tooth get an abscess?
Technically, yes. Any tooth could be susceptible. Baby teeth, adult teeth, doesn't matter the age. But the sources definitely point out that certain teeth are, well, more common culprits.
Like which words?
The big canine teeth are one group. And the large chewing teeth, especially those carnassial teeth in the upper jaw, they're really frequent sites. And this often ties right back into the main causes.
That makes sense. Okay, so we've got a handle on what it is and how it can spread. Let's shift to why it happens. What are the main reasons a tooth goes non-vital and ends up abscessed?
The number one cause, according to pretty much all the sources, is trauma that damages the pulp, the inside part leading to infection. And the most common way that happens, a tooth fracture that actually exposes the pulp cavity.
That soft living tissue inside the tooth.
Right. Exposing that just lets bacteria from the mouth flood in. And the sources are really clear. The main reason for these fractures is chewing on hard stuff.
Ah.
They list things like bones, especially cooked ones. They get brittle antlers, those really hard nylon toys, ice cubes, rocks,
Huh.
even pets chewing on cage bars. This often causes those notorious slab fractures in the big chewing teeth.
The slab fractures, yeah, I've heard of those. So wait, something you might give your dog thinking it's good for their teeth, like a bone, could actually break a tooth and lead to an abscess.
It's a huge risk.
Yes.
Yes, a really significant risk. Other causes of fractures can be, direct trauma accidents like falls, getting hit by a car,
Yeah.
even hard knocks during play or fights, and also chronic sort of low-level trauma from misaligned teeth, malocclusion, where teeth grind against each other abnormally over time, that can also eventually damage the pulp.
So usually some kind of physical injury opens the door for bacteria.
That's the most common way, definitely. Bacteria could also potentially get in through deep cavities, though cavities are less common in pets than people, or maybe through exposed dental tubules if the tooth's protective layers get worn down.
Are there causes that don't involve, like, a break on the outside?
Well, the sources mention thermal heat trauma, but it's less common things like, say, electrical cord burns. And like we talked about, really severe periodontal disease, making a super deep pocket, can let bacteria get to the pulp system from around the root.
Okay, so bacteria get in, the inside tissue dies, infection travels down to the root tip, builds up, abscess forms. Sounds like a pretty standard process.
It generally is, although the sources do note that technically you can get sterile abscesses without bacteria being the initial trigger, but honestly, infection is almost always the case.
Got it. Now this is where it gets tough for pet owners. The signs. You said pets hide pain. What should someone be watching for, especially the subtle stuff?
Yeah, this is so important, and the sources really stress it. Because pets are often so stoic, the signs can be anything from super obvious to incredibly subtle, or they might come and go.
Okay.
Some signs in the mouth might be, but not always, a visibly broken or discolored tooth. A tooth that's turned dark, maybe gray or purple, that can mean the pulp has died.
But unlike a fresh break with a live nerve, the sources say an abscessed tooth itself might not hurt if you just, like, touch the tooth.
Exactly. Because the pain isn't from the dead stuff inside the tooth anymore. It's coming from the inflammation and the pressure building up in the bone and the tissues around the root where the infection is spread.
Ah, okay.
Other signs around the mouth could be bad breath, sometimes really foul, like putrid smelling, maybe reluctance to chew on one side, dropping food or pawing at their face. You might also see swollen red gums right around the bad tooth. And in really chronic, long-standing cases, the tooth might even become loose.
And then there are those more dramatic facial signs you mentioned before.
Yes, and these are often what finally gets the pet to the vet, especially if it's one of those upper carnassial teeth.
Right.
Because the roots of that tooth sit right under the eye socket.
Right.
An abscess there commonly causes swelling on one side of the face, just below the eye.
Like a really noticeable bulge or lump there.
Precisely. Or, like we discussed, that pressure builds and it forms that draining tract on the cheek below the eye.
Yeah.
It looks like a sore that keeps coming back, or maybe a little hole that oozes discharge. A lot of owners mistake that for like a spider bite or just some skin thing.
So if you see swelling or a sore that won't heal below your dog's eye, that's a huge red flag for a tooth root abscess.
Massive red flag. Especially involving that upper carnassial tooth. It's the most common one to cause that specific sign. The sources also mention if the infection spreads into the nasal cavity or the eye socket, you might see things like one-sided nasal discharge, sneezing, maybe nosebleeds, or even eye discharge.
And in really bad cases, could you see, like, general signs of sickness? Lethargy, maybe?
Yes, the sources do note that lethargy or fever are possible if the infection gets more significant. But, and this is crucial, they really emphasize that a tooth can look totally fine, show no obvious signs at all, and still have an active underlying infection, which could even be seeding bacteria into the bloodstream. This really hammers home why just looking isn't enough for diagnosis.
Okay, that leads us right into diagnosis. How do you actually figure this out for sure? Especially if the signs are hidden or could be something else. The sources are really clear. You can't just peek in the mouth and know.
You're absolutely right. A definite diagnosis needs a really thorough evaluation, and the sources absolutely stress this has to happen under general anesthesia. Trying to properly check every single tooth, look for tiny fractures, probe deep periodontal pockets. You just can't do it reliably when a pet's awake, especially if they're sore. It's impossible.
So anesthesia is basically step one for a real dental exam.
It's mandatory for a truly complete exam, yes. Under anesthesia, the vet does a full oral assessment, checks every tooth, systematically fractures, discoloration, mobility. If they find a fracture, they'll carefully probe the exposed bit with a dental explorer.
Okay.
But the absolute gold standard, the non-negotiable tool for confirming a tooth root abscess, according to all the sources, is intraoral radiography. dental x-rays.
Dental x-rays. Why are they so vital? What do they show that you just can't see?
They are critical because they let you see what's happening below the gum line and inside the bone around the roots. That's where the actual problem is located.
Hmm.
The classic thing you see on an x-ray that indicates an abscess is what's called a periapical lucency.
So lucency, like a dark spot on the x-ray.
Exactly. It's a dark area, often kind of circular or oval, right around the tip of the root. It represents bone that's been lost or destroyed by that pocket of pus and the inflammation.
Uh-huh.
Seeing that periapical lucency on an x-ray is basically definitive proof of an abscess. And the sources strongly recommend taking x-rays of the whole mouth while the pet's under, just to check for any other hidden dental issues.
So the x-ray confirms that destruction around the root tip that's totally invisible otherwise. The sources also talk about making sure it's not something else, right?
Yes, absolutely crucial. You have to rule out other conditions that might cause similar signs or maybe even look a bit similar on an x-ray. Things like tooth resorption, certain kinds of oral tumors,
Oh, okay.
like squamous cell carcinoma or fibrosarcoma, maybe cysts, or even just normal anatomical features that someone not trained in dental x-rays might misinterpret. That's why accurate interpretation of those radiographs is so key.
Okay, so diagnosis confirmed, usually by x-ray under anesthesia. What next? Treatment. And the sources seem pretty strong on their message about just using antibiotics.
They are very, very clear about this. Look, antibiotics are often prescribed, especially if there's obvious swelling or draining tract, and they can help manage the bacterial infection, reduce the symptoms temporarily, make the pet feel better for a bit.
Right.
Pain medications, too, often NSAIDs or sometimes stronger stuff, they're vital for comfort. Maybe warm compresses for facial swelling.
But the big takeaway here is
Antibiotics alone are not a cure. This is such a critical message from the veterinary sources. They really want owners to understand this. Antibiotics can tamp down the active infection signs, yes, but they don't get rid of the source of the whole problem,
which is
the dead infected tissue inside the tooth and that pus pocket sitting in the bone. As soon as you stop the antibiotics, the infection, the pain, it's almost guaranteed to come right back.
So the real treatment has to deal with the tooth itself.
Exactly. Definitive treatment means you have to drain it and completely eliminate that source of infection. And that means doing something with the affected tooth, again under general anesthesia. The two main options are either extraction or root canal therapy.
Extraction just means pulling the tooth.
Yep, taking it out entirely. This is the most common approach and it's highly effective. You remove the tooth, you remove the source of infection, done.
Mm-hmm.
The sources often describe this as a surgical extraction, especially for the bigger teeth. That means the vet might need to lift a little gum flap or carefully remove a tiny bit of bone to make sure the whole root comes out cleanly. Then they clean the socket and usually stitch it closed.
And pets really do okay after losing a tooth, even a big one.
Surprisingly well, yeah, according to the sources. The prognosis after extraction is excellent. That significant chronic pain source is just gone. Their comfort, their quality of life, it improves dramatically. Pets adapt incredibly quickly, even to losing a major chewing tooth like a carnassial.
Okay. What about if you want to try and save the tooth? Is that where root canals come in?
Yes, that's the alternative, if preserving the tooth's structure and function is, important. Root canal therapy, or endodontic treatment, involves going into the pulp chamber.
Right.
Carefully removing all that dead and infected pulp tissue from inside the crown and way down into the root canals, cleaning and disinfecting those canals really well,
Yeah.
filling them up with a special inert material, and then sealing the tooth. Often they'll put a filling or maybe even a crown on top.
When would someone choose a root canal instead of just pulling it?
The sources suggest it's typically considered for what they call strategically important teeth, like those big canine teeth, or the really crucial carnassials, especially maybe in working dogs, or if the owner just really wants to keep the tooth's appearance and function.
Uh-huh.
But you need enough healthy tooth structure left for it to work. It's definitely a more technically complex procedure, and the sources generally recommend referral to a board-certified veterinary dentist, or at least someone with advanced training, for the best shot at success.
And is root canal treatment usually successful?
Generally, yes. The success rates reported are good to excellent, often over 90%. But it does require follow-up dental x-rays later on, usually like several months to a year later, just to confirm that the bone lesion around the root tip has actually healed up. That shows the infection is truly gone.
So either extraction or root canal, but something definitive needs to happen to the tooth itself under anesthesia. What about aftercare?
Yeah, the sources mentioned typically continuing antibiotics and pain relief for a bit after the procedure, feeding a soft diet for maybe a week or two while things heal, and definitely restricting any hard chewing for a while. Follow-up exams and sometimes more x-rays are needed, especially after root canals.
Okay, we've covered what it is, why it happens, the signs, diagnosis, treatment. What about trying to stop this from happening in the first place? Prevention.
Prevention is definitely key, and the sources offer some pretty clear advice. Ideally, daily oral hygiene like brushing can help prevent the plaque and tartar that leads to severe periodontal disease. That's one potential pathway to an abscess, remember?
Right. And avoiding those risky chew items you talked
Oh,
about.
absolutely critical, and often overlooked by owners.
Yeah.
Educating people about the dangers of extremely hard chew objects is a major prevention step. The sources are very specific. Real bones,
Mm.
cooked or raw,
Mm.
antlers, hooves, ice cubes, those super hard nylon toys that have no give at all. These are notorious for causing those slab fractures that directly expose the pulp and lead straight to abscesses.
Yeah.
Recommending safer alternatives is vital flexible rubber toys, VOHC-approved dental chews, things like that.
Mm.
There's a good rule of thumb. If you can't indent it with your fingernail, or if it would hurt you if you whacked your kneecap with it, it's probably too hard for your pet's teeth.
That's a great way to put it. The sources also really emphasize regular vet checkups, specifically mentioning dental exams under anesthesia.
This is probably the single most important prevention, or at least early detection step. Having annual, or maybe even semi-annual, oral exams done under general anesthesia, combined with those full-mouth dental x-rays, it's just crucial for finding problems before they become obvious, painful abscesses.
Right.
Things like fractured teeth, early periodontal disease, maybe subtle bone changes around root tips that can show up on x-rays, even if the tooth looks totally fine visually and the pet isn't acting like anything's wrong yet.
Because, like we said, a tooth could look perfectly healthy on the outside, but have this infection brewing deep down at the root.
Exactly. And catching and treating periodontal disease early, before it gets really severe, can also stop it from ever getting deep enough to involve the tooth apex.
So it sounds like the prognosis is excellent with the right treatment, but it can cause significant pain and potential issues if it's missed, partly because pets are just so good at hiding it.
That really is the core message from all this material, yeah.
Yeah.
Untreated abscesses, they just don't go away on their own. They cause chronic pain, they're a constant source of infection, and they can lead to worse things like major bone loss, even jaw fractures in severe cases, or that rare systemic spread. But effective treatment, it restores comfort and makes a huge difference in their quality of life.
Well, we've certainly gone deep into these sources on canine and feline tooth root abscesses today. We've covered, how they form, how they spread, the signs to look for, even the really subtle ones, all the way through to why diagnosis under anesthesia with x-rays is so important, and the definitive treatments like extraction or root canal.
Yeah, and we touched on why antibiotics aren't the whole answer, just a temporary fix, and those really crucial prevention steps, especially being careful with hard chews and the real value of those regular, thorough dental checkups that actually look below the surface.
What really stands out, I think, is just how common this problem is, yet how often it kind of flies under the radar, because our pets are just masters of hiding pain. But it's also really clear how effective and honestly life-changing proper treatment can be for them.
Which really leads to an important thought.
Yeah, here's something for you to think about as you go about your day. Knowing how often these tooth root abscesses happen and how silently they can progress until they're quite advanced. How does understanding all this maybe change the way you think about your own pet's routine vet visits? And, the importance of really assessing their oral health beyond just what you can see on the surface.
Thanks for joining us for this deep dive.